Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. You know, cervical cancer is the second most common female tumor encountered worldwide. Now, the good news is that over the past 50 years, annual rates of cervical cancer have declined by more than 75% thanks to the introduction of the Pap smear, which is an effective early detection test for cervical cancer, and its precursor, which is cervical dysplasia. So cervical dysplasia can morph into cervical cancer. Yet cervical cancer remains a critical health challenge in the modern era. Now, the causes of cervical cancer are shown to be multifactorial, including such risk factors as contracting the human papillomavirus through intercourse, or the HPV virus. Also, smoking is a risk factor. Alcohol consumption increases risk, in fact, in a dose-dependent manner. The more alcohol you drink, the greater the risk. Having multiple sexual partners and genetic predisposition are also risk factors for cervical cancer. As well, nutritional factors and nutritional status of key nutrients are also associated with the risk of developing cervical dysplasia and cervical cancer, and the nutritional factors are not often mentioned in this discussion as much as they should be, because there's some very good evidence here. So in 2012, a review of the published articles concerning the relationship of nutrition and cervical cancer and cervical dysplasia was published in the journal Osteopathic Family Physicians. So these researchers did a great review of all the published studies. The researchers stated, a significant body of research suggests that a diet rich in fruits and vegetables may protect against various cancers. In addition, protective effects have specifically been observed for dietary and blood nutrient levels of folic acid, vitamin B12, vitamin C, vitamin A, vitamin E, and fiber. Now, in one study, higher levels of vegetable consumption were associated with a 54% decreased risk of human papillomavirus persistence in women. So that means this, that the human papillomavirus persistence, or HPV persistence, means that they do an HPV test and they see you have a positive infection. And then they wait between 2 and 72 months and they do a second test, and if it's still there, then it has persistence. In most cases, within a 24-month period, the HPV virus infection disappears on its own. So what you see is that in this study, higher levels of vegetable consumption were associated with a 54% decreased risk of HPV persistence. Now, in addition, women with the highest level of lycopene had a 56% reduction in HPV persistence compared with women with low levels. So lycopene is a naturally occurring nutrient found in red tomatoes and red peppers and watermelon. Things that are red, they're red in nature because they have lycopene, and that's what makes them red. So this suggests that increased vegetable consumption, particularly vegetables rich in lycopene, may be protective against HPV infection, according to these researchers. Now, results of a hospital-based case control study, this is where they look at women that have cervical cancer versus other women who don't have it. They showed that in this control study of cancer, found that a higher intake of dietary fiber, vitamin C, vitamin E, vitamin A, alpha carotene, beta carotene, folic acid, a B vitamin, lutein, and lycopene were related to a significantly decreased risk of having cervical cancer. As well, women with higher blood levels of folic acid and vitamin B12 had a 70% reduction in cervical dysplasia type 2. In other words, cervical dysplasia comes in 3 different degrees. First, you have stage 1, stage 2, and stage 3. Stage 3 is more advanced, then it becomes cervical cancer in many cases. So women with higher blood levels of folic acid and B12 had a 70% reduction in stage 2 cervical dysplasia compared with those with low folic acid levels and insufficient vitamin B12 levels. So it's believed that folic acid levels modulate human papillomavirus persistence and thereby influence cancer risk, cervical cancer risk. It was found that women who had positive HPV infections had a 5-fold greater risk of having cervical dysplasia if they also had low levels of folic acid in their red blood cells. So the very best test for your folic acid status is how much folic acid is in your red blood cells. It gives you a snapshot of sort of a 3 or 4 month window of your folic acid intake. These studies suggest that the effect of diminished folic acid status on carcinogenesis, the development of cancer, does not require like frank folic acid deficiency, similar to that would result in anemia. So if you have really low, super low levels of folic acid, you're going to have anemia. They're saying just modest reductions of folic acid, a marginal deficiency, is all that's necessary for the effect of cervical dysplasia and cervical cancer to manifest itself, especially in the presence of an HPV infection. They go on to state, studies indicate that less than adequate levels of folic acid in the diet increase the risk of cervical cancer. This has been found to be particularly true in individuals who consume alcohol on a regular basis. Why is that? Because alcohol depletes the body of folic acid. As well, oral contraceptive use, a well-known independent risk factor for cervical cancer, has been associated with compromised folic acid status. Studies have found that folic acid supplementation can improve stage 1 and stage 2 cervical dysplasia in women who take oral contraceptives. That means there are studies showing that women who are taking oral contraceptives who develop stage 1 and stage 2 cervical dysplasia, if you fortify their body with more folic acid, it often reverses back to a normal pap smear. This is impressive stuff. It should also be noted that a profound risk reduction of cervical cancer by 44% has been observed in women who exercise more than 3 to 4 times per week, doing aerobic activity primarily. So exercise is helpful to reduce the risk. The researchers concluded at the end of the paper, physicians may suggest to patients at risk for cervical cancer that a diet rich in fruits and vegetables, particularly leafy greens such as spinach, kale, turnip greens, and collard greens, may reduce their risk. Those dark green leafy vegetables have a lot of beta carotene and other carotenes in them that seem to be protective. In addition, for patients who find such a diet challenging, and many people do, physicians should recommend dietary supplementation to ensure patients' nutritional needs are being met. And those vegetables also have a lot of folic acid, by the way. So due to the fact that many women do not ingest optimal levels of many key nutrients each day associated with cervical cancer risk reduction, such as vitamin A, such as not just vitamin A, such as vitamin E and folic acid, lycopene, other carotenes, and vitamin A, a lot of individuals, not just women, don't get enough of these nutrients to get optimal nutritional status. I often recommend a high-potency multiple vitamin and mineral as an additional insurance against overt nutritional deficiency, as well as the more common undetected marginal deficiencies that appear to be a factor in increasing risk of cervical dysplasia and cervical cancer. Of course, regular exercise also appears to be an important preventive strategy as well, so don't leave that one off your list. Now, in the next Lifestyle Medicine Update, I will highlight the impressive research showing the ability of a phytonutrient found in cruciferous vegetables, namely indole-3 carbinol supplementation, to reverse certain cases of cervical dysplasia back to normal pap smear results. So stay tuned for that. But in the end, nutritional medicine is good medicine, and not enough emphasis is placed on this aspect of health and well-being, in my view. So I've included the reference for this review paper on nutrition, cervical cancer, and cervical dysplasia in the text below. Thanks for watching, and I'll see you next time.